Predominantly, I am followed by my fellow South Asians. Hi, guys. This one is for you. I had to literally pass on my sentiments about this study that I came across on the tube today. Many of you will already know that the government and health experts do recommend that you exercise 150 minutes per week. This study is basically telling us that as South Asians, unfortunately, this is not going to have the same effects on a South Asian person as it does on a white Caucasian person. And there are many reasons for this. Put aside that mentality of it's not fair first. I'm Tej, I'm a transformation specialist for the over 40s, and yes, I predominantly work with South Asian women. Now, the study is basically explaining that South Asians need more activity, higher activity levels, in order to get the same health benefits as our white or European counterparts. Now, this is going to go some way to help our predominant health conditions like cardiovascular diseases and diabetes, those being the most prolific conditions that our people tend to struggle with the most as they age. What this study is saying is that we need more activity levels in order to ward off diabetes, cardiovascular issues, because we have a higher insulin resistance. We also carry more visceral body fat despite having smaller physiques. And also, we're more likely to suffer from metabolic syndrome. In true Tej fashion, since I've been doing this for so many years and have helped over 1,200 women to get into better shape and health, especially through perimenopause and after 40, when these conditions are most prevalent, it is the fact that it's not that we need to do more than 150 minutes. It's not the time element. It's the style of training and exercising and moving your body, and also the food choices that come along with helping your body to ward off these conditions and improve your ability to prevent those conditions from setting in as we age. Why do I make a thing of being over 40 and these conditions being an issue? Is because as it is for women over 40, as our estrogen levels lower, our insulin resistance goes up, as well as our visceral body fat that gets stored. So our peri-fluctuating hormones are not helping the case at all. So now, South Asian women over 40, we have an additional barrier that we have to overcome. And it isn't just going to be by tracking how long we are working out. Now, I will add that this was a peer-reviewed journal and lots of research was done on it. It wasn't a randomized controlled trial. However, this is a good indicator that if they applied the right conditions to a randomized controlled trial, they know what the expected results are likely to look like. Add to that as South Asians, we tend to store more belly fat on our bodies than anywhere else, ending up with that big pooch. Males and females, again, adds to the contributing factors. And if you want the science behind it, this may be coming down to South Asians having higher triglyceride levels, lower HDL, which is the good cholesterol, and also higher fasting glucose levels. But all this points to is the fact that we as South Asians have to make even more of a concentrated effort in helping our bodies and our health by taking action specifically rather than following the generic guidelines that are set out based on bodies that aren't like ours. Follow me if you want to find out what those actions are going to be, because it isn't just going to be getting your body moving 150 minutes a week like the guidelines suggest. It's going to be based on strength training more regularly, improving the intensity of your training sessions, and also eating in particular outside of the traditional South Asian high carb, high fats diet, and focusing instead on proteins and fibers to help you and your body to process those carbs and counteract the insulin resistance. I show my clients how to do this in a way that helps improve their lifestyle and their choices and help them to move and keep moving in a way that's going to help their health long term, as well as change the way that they look and feel.